It is always an exciting time to bring a new baby home from the hospital, but a little bit unnerving as well. So we're happy this morning to welcome Dr. Trey Dyer from CHI Memorial Pediatric Diagnostic Associates. Good to see you this morning.
Good to see you too.
First thing I like that you and I were talking about is you recognize the fact that for expectant parents, moms and dads, first of all, they have no idea what they're getting into.
Right.
And secondly, once the baby's born, it's a whirlwind of things happening in that hospital. So you like to prep them.
Right. So everything happens so fast. At our practice, we oftentimes schedule prenatal visits for the family to come in, meet us, see our office, learn about our office hours, and then I like to meet with the parents and kind of go over what to expect once they get to the hospital, because everything can happen pretty quickly.
And things are always evolving. This happens to be September, a month that you're focusing nationally on the screening tests that occur when a new baby is born. A lot of parents, I was one of those, thought, why are you having to test all these things? Here she is, this perfect baby, what are you doing?
Right, so we do several screens on newborn babies, and it's important because a lot of what we test for, the earlier that you catch the diagnosis, the better prognosis the child can have.
Okay.
So the earlier you catch it, the sooner you can start treatment, which can lead to longer life in some cases.
Some things I think most of us are familiar with, but we might not know what they do. So am I saying it right, the APGAR?
So yes, so APGAR is done basically instantaneously once the baby's born. That is to essentially just assess the baby's breathing, the baby's tone, the baby's color, and then from there we kind of progress on to other screens. There's a blood test that we do. It tests for a whole host of genetic disorders. It tests for cystic fibrosis, sickle cell disease. Now that blood test is done within the first 24 to 48 hours. It can take a little while to come back, so always make sure that you bring it up with your pediatrician at their 1-month appointment, 2-month appointment.
And because that early intervention is so important and proven successful, you don't want to miss a pediatric appointment when your child is, whatever really, but when your baby's first born, there are these milestone markers. If I remember right, you go in within a week maybe, and then another 2 or 3 weeks later.
Yep, the first visit is usually within a week. That visit, a lot of it is really just about establishing feeds, going over what to expect, what to watch for, and then kind of the next assigned appointment is really at 1 month of age, where we kind of monitor weight gain, monitor how they've done developmental-wise. And then 2 months is the next visit, and that's when the immunizations start. Since
you enjoy having parents come in and do those prenatal visits, let's kind of let this be one for a second on television.
Sure.
It's important to have the right fit, but accessibility to your doctor is real important.
Yes.
You have a lot in the group, which is a good thing. You can always get seen.
Right, so we have 10 pediatricians in our practice. We're open 5 days a week at 3 various locations around Chattanooga, downtown Chattanooga, one out by Gun Barrel Road, on Gun Barrel Road by Hamilton Place, and one in North Georgia. We also have weekend clinics at our clinic downtown. So we're actually open about 362 days out of the year. The only days where we don't have a clinic is Christmas Day, Thanksgiving Day, and Easter Sunday.
And when parents, again, I guess I was one of these who thought, well, no, I need to see my doctor. Not so. Everybody in the practice can look at the same information, and sometimes it can be a good thing because you get 2 sets of eyeballs on your child.
Right, exactly. I'm very fortunate to be in a great group and with a bunch of pediatricians that I trust. I was actually a patient at the group that I'm working at now.
And I'm sure that doesn't make them feel old at all.
Maybe a little bit.
So he'll be back next week because there's also a focus on having your car seat as safe as it can be for your child, and maybe some new things that you aren't aware of. So look at his face closely and catch him next week as well. In the meantime, give their office a call. It is CHI Memorial Pediatric Diagnostic Associates, easy number 698-BABY-2229, and online as well. Thank you.
Thanks.